So today, we're diving into a really practical tool that's designed to build fairness right into our health systems. It's called the Health Equity Impact Assessment, or HEIA for short. And you know, it's really all about getting past good intentions and into real, solid action. Let's get into it.
Everything really starts with this one simple question. Now, we'd all love for the answer to be yes, of course, but the reality? Well, it's a lot more complicated. Access to good health and quality care is often unequal, and that creates these gaps that can have really serious consequences for certain groups of people.
And that leads us right to the heart of the problem: health inequities. The key thing to understand here is that these aren't just random, unlucky differences. They are systemic, meaning they're literally built into our systems. They're patterned, so you can actually predict them. And most importantly, they're both unfair and actionable. And that last part is everything. It means we can and we absolutely should do something about them.
To make this less abstract, just look at this number. In Ontario, kids from low-income neighborhoods are 17% more likely to end up in the hospital for Crohn's disease. Think about that. That's not a coincidence, right? It's a flashing red light, a clear signal of an inequity baked into our system, and it shows you the real human cost of these gaps.
Okay, so let's zoom in on where this gets especially tangled: mental health. In this space, the connection between health and inequity isn't just a one-way street. No, it's more like a vicious cycle, where each problem just keeps feeding the other one.
See, this cycle flows in both directions. On one side, you have social inequity just taking a huge toll. Canadians with the lowest incomes are 3 to 4 times more likely to say their mental health is fair to poor. But it goes the other way too. Living with a mental health condition can lead to stigma and discrimination. Almost a quarter of Canadians admit to being afraid of people with mental health conditions. That fear creates very real barriers to getting a job, finding housing, and accessing services.
So, the big question is, how do you break a cycle like that? How do we start building fairness into our planning before these problems even start? Well, this is where a specific, practical tool comes into play: the Health Equity Impact Assessment, the HEIA. At its core, the HEIA is designed to fight something called the inverse care law. Now, it sounds a little academic, but the idea behind it is tragically simple. The people who need healthcare the most are often the ones who get the least of it, or they get the wrong kind of help altogether.
So the goal, then, is to flip that law on its head, and that goal is health equity. Now, this isn't about giving everyone the exact same thing. That's equality. Equity is different. It's about being intentional, about matching services and support to the communities that have the greatest needs so that everyone has a fair shot at good health.
And that's exactly what the HEIA does. It gives us a practical, step-by-step process to get there. It basically forces us to hit the pause button during the planning stage of any new project and ask a really critical question. Could this new program we're so excited about actually have some unintended negative consequences for vulnerable groups? It's all about being proactive instead of just reacting to problems later.
Okay, so how does it actually work in the real world? Let's walk through the HEIA's 5-step playbook. And to make this super clear, we'll use a real-world example from the Canadian Mental Health Association. They used it on a smoking cessation program they called Smoke Stoppers.
So here are the 5 core steps. You start with scoping, which is just figuring out who might be affected. Then you analyze the potential impacts, the good and the bad. Next up is mitigation, which is a fancy word for brainstorming ways to fix the bad stuff and boost the good stuff. And finally, you plan for monitoring to see if your fixes are working, and dissemination, which is all about sharing what you learned.
All right, let's start with step 1, scoping. For their Smoke Stoppers program, the team didn't just look at the general group of smokers. No, they went deeper. They started identifying specific groups that might be impacted in different ways, like people with low incomes or people from different ethno-racial communities.
Then in step 2, they looked at potential impacts. The positives? They were pretty obvious. People would get social support and access to a nurse. Great. But, and this is why the HEIA is so valuable, it also helped them uncover potential negatives. What if someone just isn't comfortable in a group? What about the high cost of nicotine replacement therapy? These are exactly the kind of hidden barriers the HEIA is designed to find.
And that leads us to the most important part of the whole process. Step 3, mitigation. The team didn't just identify the problems and then stop. No. They started brainstorming actual solutions. Could they team up with another organization to provide cheaper therapy? Could they bring in peers to help out, maybe offer one-on-one options? This is where the plan starts to become truly equitable.
Finally, they closed the loop with steps 4 and 5. They didn't just write up a report and let it gather dust on a shelf. They actually built these new ideas into their program. They set up ways to monitor if they were working. And then they shared what they found with other staff and even at conferences. This makes sure that learning doesn't get lost and can help make future projects even better.
So, what's the big takeaway from this smoke stoppers example? It shows us that the HEIA isn't just another form you have to fill out. It's a whole framework for thinking. It's a process that takes this big, abstract idea of equity and turns it into a set of concrete steps you can actually take.
And that really highlights the key ingredients you need for this to work. You need a clear plan, and you have to get people inside your organization on board. You need all kinds of data to see the real picture. And, crucially, your solutions have to actually be doable. And it's so important to remember, the HEIA is a powerful tool, but it's just one tool in a much bigger toolbox for building a more equitable system.
I really want to leave you with this quote from an organization that used the tool. This just gets right to the heart of it, doesn't it? The real magic of the HEIA is that the process itself changes how teams think and talk about their work. It shifts the conversation, automatically and intentionally, toward fairness.
And that brings us to the final question, one for you. Whether you're working in healthcare or maybe education or business, what hidden equity impacts might be lurking in your own plans? By starting to ask these kinds of questions up front, we can all start building a fairer world, one project at a time.